He's just kicking. You never know how things are actually going to turn out. Oh, now he's trying to ball up. So you're just pretty much walking by faith and praying for the best. And this is my baby's little face and his little hand waving. I'm shocked she was able to get these pictures because he did not sit still. I'm 7 months pregnant. My due date is December 28th, and I'm having a boy. I will be delivering this baby at Mercy, so that's kind of far. I am going to have to commute all the way there and just hope there's no complications in between. It's inconvenient.
While COVID-19 has highlighted the racial inequalities in healthcare, those disparities start at birth. In the delivery room, Black mothers die nearly 2.5 times more often as white mothers and have 2.3 times the infant mortality rate. And one of the reasons is the growing number of what are called maternity deserts in Black neighborhoods.
Maternity desert has become a popular name for an area where there's no maternity wards that are open currently. This area, like on 85th and St. Lawrence, is kind of the mid of the South Side. It's a great family-oriented area, children, 3 generations. So we're kind of smack dab in the middle of a maternity desert. If you were in labor, had any kind of OB emergency, you would have to go 30 to 45 blocks south or go 40 blocks north just to get care because the labor and delivery units are not currently open in this neighborhood.
We have an access issue, we have a quality issue, we have certainly transportation and childcare issues, people's just everyday life issues intersecting with all the issues of the healthcare delivery system not necessarily being responsive to the fact that people have really complicated lives and are poor and don't have, a lot of other things like they live in food deserts and pharmacy deserts. All of those things are overlapping with OB deserts, right?
Nationally, more than 2.2 million women between the ages of 15 and 44 live in areas with no access to maternal care. This makes the U.S. the most dangerous place for a woman, especially a Black woman, to give birth in the developed world. The U.S. maternity mortality rate is high and has been on the rise in recent years. CDC figures from 2018 show Black mothers died 2.4 times as often as white mothers.
It could be thromboembolism, a pulmonary embolism. It could be cardiomyopathy, so a heart condition, preeclampsia. It can also be blood clots that, have been ignored, or my legs hurt. Oh, that's normal in pregnancy, but not doing the appropriate workup to make sure it's not something that's lethal or that's gonna end up in a bad outcome. 70% of those are preventable. That's the scary part. We shouldn't be dying at the rates that we're dying. So right now we're on, 83rd and King Drive, which is the middle of the South Side. And for a pregnant mom who had any kind of emergency, this is the way that they would have to go, pretty much 30 blocks. Sometimes you have to realize how privileged you are to just have a car, So I've been a physician for 19 years. I grew up, born and raised on the South Side of Chicago. So my mission has been to be in underserved populations and to take care of the patients that generally don't have a voice. Hi, need to come in this room. Being an African-American woman, first and foremost, it's a challenge. Being an African-American physician, it adds even more challenge to it. For me, because I've always wanted to take care of my people, my population, and for those that are underserved, it just makes it very challenging to give the best care that I need to give and I want to give with some of the limitations that we are presented with currently. Hello there.
Hi, how are you?
Good, how are you? I've seen personally just the racial bias that has been encountered with a lot of patients with providers that were not of the same upbringing or racial background. And a lot of times, patients will walk out of the office not understanding anything, haven't had their problems addressed, and feel like they're just swept under the rug and not cared for.
It's devastating, it's concerning, it's very concerning because you want to make sure that these people have your best interests at heart. I need to actually pick these. It's hard. when you are being told that you have to travel so far just to go to prenatal care, just to get your medication, just to see a doctor, or you may think that you're having contractions or whatever. And not a lot of people have the option of being driven, or you have to rely on your insurance to pay for transportation, and it's not guaranteed that you'll get it.
You know, it's always been there. These racial and ethnic disparities have been there. We've, sort of pushed them under the rug. I think all of a sudden people woke up. This is a serious issue.
The biggest thing that needs to change to make this problem not as big of a problem is education, just knowing when something is wrong and speaking up, not feeling scared to tell your provider what's really going on, because that is a big issue. I don't mind you asking me questions. You should ask a question. It shouldn't be, I'm telling you this, okay, well, you said so. Just getting the care that you need.
It's very scary. It's like you're just stuck with whatever we're stuck with. We're getting pretty much the end of the barrel at this point.
In the 1980s, we had close to 200 deliveries a month here. But over the years, we've seen a decline in birth rates. Last year alone, we went from 100 deliveries down to an average of about 50 deliveries a month.
Hospitals are businesses and they have to survive, and you have to have a certain volume to be able to maintain an OB delivery unit. The volume of patients has decreased. When Rahm Emanuel closed 50 schools, you lost a lot of people. People said, why am I staying in this neighborhood? I don't have a neighborhood school anymore.
It's all connected. Hospitals, like any business, look at their services as line items to determine what's profitable and what's not. When birth rates decline like they have in recent years across the country, their ability to recoup costs falls below an acceptable level of profitability. Add in the fact that lower income communities depend on additional funding to recoup the cost of Medicaid patients, that's when community hospitals like St. Bernard Hospital on Chicago's South Side have to make a tough decision. And in a pandemic and shifting state and federal funds to recoup these costs, that tough decision comes much faster.
The patients that we're delivering here at the hospital relied heavily on Medicaid as their insurance coverage. And with Medicaid, it really doesn't pay for the cost of the care that we provide. So we rely heavily on the government for that support. Right now, the funding is just not present.
Also today, plans for dismantling the alternate care facility at McCormick Place now underway.
When they built McCormick for COVID patients, why didn't they say to every hospital, because we built McCormick for COVID patients, we're going to keep the birthing centers open? I mean, they could have strategically thought about this.
A lot of our moms are high risk. A lot of them have hypertension. They have gestational diabetes. They have a lot of issues that other women may not have because of the socioeconomic environment that they live in.
A woman who's poor may not have access to good food. There might not be decent grocery stores in her neighborhood, and she would have to travel far to get decent groceries. So she might eat poorly, and then she might be more likely to be overweight or obese. She might be stressed because she lives in a neighborhood where there's a lot of community violence, and all of those things put her at risk for hypertension, diabetes, conditions that affect her well-being prior to pregnancy and then during pregnancy. We need healthy women before we can have healthy babies. It should not be a trade-off between one kind of patient versus another kind of patient. This patient's profitable, that patient isn't. We at least need to give rates of reimbursement that make it in the hospital's best interest to support women during pregnancy and delivery.
I think the government has to pay attention because the focus is on us now.
So if I was currently pregnant and in the world as it is right now, I would be scared to death. I mean, I'm just being honest. Like, where would I go? How far would I have to drive in an emergency to get the care that I needed? So I think we also have to look at the stress that is put on these patients. First of all, they're pregnant. That's stressful in itself. But then the access to care and the resources, I mean, I would probably be going crazy, like most of our patients are.
I was in labor for 57 hours.
It was just 57,
It was
Akiva.
just 57.
People
I
do
know.
lots of things for 57 hours.
Yeah, I was in labor
Straight.
for 57 hours, where my contractions were less than 10 minutes apart the entire time.
back to back.
Now I'm really at my weakest and most vulnerable. I am at the point where I'm delirious, I'm tired, I am exhausted, and I am in full physical pain. Oh.
Can I hit this light?
Yes, let's turn the light on. Oh.
He eating and pooping every day, right?
He is eating and pooping a lot.
What is
And he
this?
probably needs to, this is his umbilical cord.
It's still on?
No, it fell off yesterday.
But it's just a little residue.
Yeah.
Yeah.
But when I found out that I was pregnant, it was in December. And so throughout my entire pregnancy, from December through August, where everything was up in the air. Folks didn't know, like, were we gonna shut down? How are you gonna go to the doctor? They were talking about not even letting folks come in to the doctors and doing conference calls, which I didn't feel like that benefited me. I wanted somebody to touch me or see me and physically feel that I was, like, being heard. And so my options was finding a doula and a midwife.
Doulas are non-clinical professionals who provide a range of emotional and informational support to women throughout the pre- and postpartum process. Studies have shown that access to doula care can reduce factors that lead to higher rates of maternal morbidity and mortality among women of color.
I think mid-level providers like that do help, and it's a holistic approach to the patient because it's not just taking care of their medical problem, it's kind of getting to the root of all the other things that may be going on that is affecting them from getting the care that they need.
I have to be mindful of the things that she might be doing at home that could cause stress on her body. Is she moving around? Is she trying to take her dogs out? Is she trying to make food for herself? Is she trying to clean up? She also lives with her mom, so is her mom doing these things also? Because the truth is, we think that the scary part of maternal mortality can happen in the hospital, but there's a year after someone has a baby where they're at risk of any type of complication, a sickness or illness or an injury. So we like to be extremely mindful, even up to 11 months, 12 months postpartum, and that you're allowing your body really like a year to heal, because it needs that long. I need that long. I am exactly the person that I'm trying to help. This is where you work, you live, and there are no hospitals there. It feels like, man, am I supposed to be doing this? Does my city or, does my neighborhood, does my environment care the most about me being and feeling well and then having a safe place to birth my baby and then bring my baby home to, or access prenatal care, or if I have any type of emergent care that I need to seek?
Well, there you go.
Thank you. You're the best doula ever.
You're the best mom
Man.
ever.
What?
Yep, right about there, this way. And you just squeeze it right on there like that.
And it's supposed to suction cup on?
Yep, it'll suction on, and then you can catch the milk, and then you turn it and you feed the baby like that.
Whoa.
You don't have to pour it out. You just
Yo,
feed it
I
right there.
fed him like that the other day. It was
Off a cup, huh?
So cool.
It was
I'm like,
amazing.
you ever seen a baby drink out of a cup?
I told you.
We're severely overlooked. And I knew going into the hospital on a regular basis without me being pregnant that I generally have to advocate for myself. You generally need someone to either advocate for you or advocate for yourself in those spaces. And so I felt that it was important that I had a Black doula who was into actually caring for Black babies and Black moms because it's more relatable.
We have a medical system that places people like Akiva, people like myself, who are Black, maybe look a certain way, present a certain way, and they say, you don't hold the same value that I do. So because we have a medical system that functions that way, we can't pretend that everybody's gonna get equal care. We can't pretend that way at all. And I think it's a slap in the face. One of my favorite midwives, she says, you cannot make anything else from a dented pan but dented bread. So as long as this system
is banged up and broken up, it don't matter what type of formula you put in it, it's gonna come out that way. And so we are laboring ourselves, Black women, Black people, Black birthing bodies, we're laboring ourselves trying to make something else out of this system, but dented bread.